Breast cancer is the most common form of cancer in women today. Knowing more about your own breast anatomy can help you in early cancer detection and prevention. Your breasts are connected to small masses of tissue called lymph nodes by way of lymph vessels. The lymph nodes are responsible for collecting bacteria, cancer cells, and other unhealthy material. You have groups of these lymph nodes under your arms, above your collarbones, and behind your breastbone, as well as in other parts of your body. Each breast is made up of lobes, lobules, and ducts. The lobes consist of smaller lobules that contain groups of tiny milk-producing glands. When a breast is producing milk, it passes through the ducts into the nipple, where it exits the body. Breast cancer most commonly develops in the lobules, glands, and ducts of the breast. Breast cancer symptoms can vary from woman to woman, but there are several common signs to look for. You may notice a change in the way your breast or nipple feels. This may present as a lump or nipple tenderness. Other symptoms can present as a change in how the breast or nipple looks. Changes in breast size or shape, a nipple that is turned inward, changes in the texture of the skin of the breast, areola or nipple, or fluid discharge from the nipple are all frequent symptoms. In many cases, early breast cancer usually does not cause pain. However, you should always see your doctor about any breast pain or any other changes you notice that do not go away. The staging of breast cancer refers to the extent of the disease. The cancer stage is based on several factors, including the size of the tumor, if any lymph nodes are involved, if the cancer is invasive or non-invasive, and if the cancer has spread to areas beyond the breast. Stage 0 is considered a non-invasive breast cancer. In this stage, there is no evidence that the cancer cells have spread into neighboring breast tissue beyond the duct or lobule. Stage 1 is considered an early stage of invasive breast cancer. When measured, the tumor is no more than 2 centimeters in diameter, and there is no evidence that the cancer cells have spread beyond the breast. Stage 2 is divided into subcategories of 2A and 2B. Stage 2A is invasive breast cancer, where the tumor is either a maximum of 2 centimeters in diameter and has spread to the lymph nodes under the arm, or the tumor is between 2 and 5 centimeters in diameter but has not spread to any lymph nodes. Stage 2B is a little different in that the tumor is either between 2 and 5 centimeters and has spread to underarm lymph nodes, or the tumor is larger than 5 centimeters but has not spread to the underarm lymph nodes. Stage 3 is considered a locally advanced cancer, and it is also divided into subcategories of 3A, 3B, and 3C. There are 2 main scenarios that can occur with stage 3A breast cancer. One, where the tumor is no larger than 5 centimeters in diameter, but it has spread to underarm lymph nodes that are growing into each other, forming clumps. The cancer may also have spread to the lymph nodes near the breastbone. The second scenario for stage 3A is very similar, with the exception that the tumor is larger than 5 centimeters in diameter and that the underarm lymph nodes are not adhered to one another or other tissues. Unlike the other stages, in stage 3B, the tumor may be any size and has spread into the skin of the breast or chest wall. This stage may also include lumps in the skin of the breast or swelling of the breast. In stage 3C, the tumor may also be of any size but it has also spread to lymph node areas above or below the clavicle, the chest wall, and/or the skin of the breast. Stage 4 is considered distant metastatic cancer, meaning the cancer has spread to other organs and parts of the body. Treatment options for cancer include surgery, radiation therapy, chemotherapy, and hormone therapy. There are several surgical options depending on the severity of the cancer. A lumpectomy removes the tumor and a small amount of neighboring tissue. Mastectomies involve removing the entire breast and its tissues. Lymph node removal is typically performed in addition to lumpectomies and mastectomies. Here, the surgeon will remove lymph nodes from under the arm if there is any reason to believe the cancer has spread beyond the breast. A prophylactic mastectomy is a preventative surgery for high-risk women that removes the entire breast to lower the risk of breast cancer. Radiation therapy uses high-energy X-rays or other types of radiation to kill the cancer cells or to keep them from growing. Internal radiation therapy can be used to treat the cancer from the inside of the body with needles, wires, or catheters. Chemotherapy is a treatment that uses drugs to stop the growth of cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body. Some types of breast cancers need hormones in order to grow and spread. Hormone therapy works by blocking the cancer cells from receiving the natural hormones that they need. Tests can show if your breast tumor has these receptors and if it is a good treatment option. Breast cancer prevention includes actions you can take to lower your chance of developing cancer. By avoiding certain risk factors, you may help prevent cancer. Although not all risk factors are avoidable, some, like smoking, are. In addition to avoiding risk factors, there are some things that can also help to decrease your chance of getting cancer. These are called preventative factors, and they can be as simple as eating healthy food, exercising, and doing monthly self-breast exams. There are also hormone inhibitor drugs and vitamins that may also decrease your risk of cancer. Be sure and talk to your doctor about ways to reduce your risk of breast cancer.